Hi, my name is Adolph Lombardi. I'm an orthopedic surgeon practicing here in the greater Columbus community. The name of our practice is JIS Orthopedics. I'm going to talk to you today about hip arthritis. Now, when we use the term arthritis, what do we mean? We mean an inflammation of the joint. There are basically two types of arthritis. There is the primary osteoarthritis. There's a secondary form of osteoarthritis, but it's either osteoarthritis or it's inflammatory arthritis. So if we talk about osteoarthritis, we have, as I say, the primary form, which is the wear and tear phenomena that unfortunately many of us get as we age. There is a genetic component, but it's multifactorial. There are some secondary causes. For example, if you had trauma to your hip, you have post-traumatic arthritis, it's a form of osteoarthritis. There also can be osteoarthritis from some childhood developmental problems, such as developmental dysplasia of the hip, or something called Legg-Calvé-Perthes disease, or slip capofemoral epiphysis. These are all things that occur in childhood. You would have known you had this experience, and these may cause arthritis later in life. Now, when you come to the inflammatory arthropathies, we're talking about rheumatoid arthritis, the gouty arthritis, the psoriatic arthritis. Fortunately for us, I have seen a significant decrease in these types of arthritic deformities because of the great medications that have come on board. Now, arthritis leads to this sort of grinding of the joint, a halting of the range of motion. It's a very painful situation because the lining of the joint, which we call synovium, secretes a massive amount of fluid. It's all inflamed, and then the body sets up a reaction to restrict the motion to decrease the pain. And that motion is restricted by spurs that form around your hip. The hip is a beautiful ball and socket, but once you get osteoarthritis, you lose that smooth, shiny cartilage, that cushion, both on the socket side and on the ball side. Things start to stiffen up. You then get those spurs that lock the joint even further. Then there's a pressure buildup from the fluid that I talked about that forms these little cysts. Now, they're not tumors, they're cysts or arthritic cysts. Not to worry, they will not harm your result from a joint replacement. So what we do when we do a hip replacement is we are effectively creating a new ball and socket mechanism so that you can regain that lost flexibility. You'll be able to once again tie your shoe, to do simple things in your profile of activities of daily living. Now, you'll be able to do a lot more than that. I always get asked the question, what do you restrict me from doing? I say nothing. I mean, it's intuitive that you want to go out and run a marathon, you're going to impact load, and you're going to decrease the life expectancy of that implant, but it will tolerate it. It's kind of like the automobile that you bought. You can drive it for 100,000 miles and you know what it's going to look like, or you can baby it and you know it's going to look great. So I'm a caraholic. I don't drive my cars a lot. So if you want to go out and drive your hip, go ahead and do it. It'll tolerate it. And you'll be back for a liner change. But I can tell you that in the recent years, the materials have gotten so much better. My history with doing this extends over 37 years. And I started with some really poor plastic material that we call polyethylene. And it did not face the test of time. We then went to metal-metal articulations, thought we were doing really well, but again, there was a little issue with metal ions. And now we have a beautiful pink ceramic that doesn't fracture on a highly cross-linked polyethylene. And I am now seeing data that I can tell you 20 plus years of survivorship with average utilization of your hip joint. So if you're experiencing pain, decreased motion, getting harder to tie those shoes, get out of your car, get up from a chair, climb the stairs, whatever it is, come see us at JIS Orthopedics.